And Cory, why don't you go ahead, folks? This one is with Cory Vaske, the Stearns County Veteran Services Officer. And Cory, thanks for being here.
Thank you, Steve. And I thank you to Minnesota Association of Townships for inviting me. Glad to, I do these benefit briefings by request, mostly within Stearns County and sometimes to larger groups. But as Steve said, I am the County Veteran Service Officer in Stearns County, also the Director of Veteran Services here and Department Head in Stearns County, Minnesota. Just to start out with, we'll talk a little bit about what is a County Veteran Service Officer. In Minnesota, counties have been required to have a County Veteran Service Officer since either 1945 or 1946. I don't recall exactly, but it's been a number of years. Essentially, it is an unfunded mandate requiring the counties to carry a County Veteran Service Officer. From the beginning, essentially, CVSOs have assisted veterans with benefits. CVSO in each county is appointed by the county board. We are not VA employees. We are employed exclusively under the jurisdiction of the county. Historically, CVSOs we strive to be kind of a one-stop shop. You'll hear some catchphrases from CVSOs from time to time as that we are a one-stop shop for veterans benefits, or in some ways kind of a gateway to benefits. There have been a series of changes in recent years, and our business has continued to change quite a bit in response to policy and law changes with the VA. In many ways, it's required an increase to some technical expertise regarding assistance with disability claims. And as such, CVSO offices, even in larger counties, are typically have smaller staffs. And so it has put us in a bit of a position where we're often choosing between, the level of service that we can provide or a level of assistance that we can provide, and weighing that against, the broad scope of assistance that we provide to clients. In Minnesota, just for everyone's understanding or of when I talk about veteran population, what I'm referring to, I'm assuming everyone here knows what a military veteran is. Essentially, there are different definitions depending on the organization, whether it's the federal or state, and sometimes depending on which agency within the federal government and the benefits being provided. But essentially, and just generally, there are about 312,843 veterans in the state of Minnesota. That's based on a 2018 population study that was released just last year, and that's for 2020. Over the next 10 years, just for perspective, the veteran population is expected to decrease by about 23% over the next 10 years. The estimated population 10 years from now is just under 241,000 veterans. A few trends I think important to note in terms of veteran populations. Women veterans population is actually increasing slightly over the next 10 years. In terms of the gross numbers, we're looking at an estimated change from about 25,945 to 27,334. Again, these are estimates, but essentially what we're seeing is more women are choosing to serve in the military. And as that veteran population decreases overall over the next 10 years, we will see women veterans as a percentage of the overall veteran population increasing. I think this is important. I won't talk about this much in the rest of the presentation, but something of note is that women veterans tend to not participate or use the veterans healthcare system at the same rate at which male veterans do. And I think that that's something that's kind of it's been an area of focus for the VA and for veterans advocates for the last couple of years, but essentially it's something that I think will become more of a prominent issue or talking point in the next few years. Okay, county veteran service officers. What roles do we play? So in some ways, as I mentioned earlier, since the CVSO is required, for mandated for every county, um, the roles as outlined in the statute are, in my opinion, relatively narrow. It essentially, under 197.603, just requires CVSOs to assist all residents or anybody essentially eligible for benefits on the basis of veterans service in accessing benefits provided by law on account of that veteran service. So um, a lot of and I'll kind of get into some of those benefits, but we're talking about VA disability compensation, veterans health care or VA health care, VA home loan, education benefits, and so forth. Uh, all in addition to that, the state statute requires that CVSOs uh, assist prior service members, regardless of their character of discharge, as securing counseling treatment for alcohol and drug dependency and abuse. So, uh, it, when I in the reality of what CVSOs do is it's generally broader than that. Essentially, um, CVSOs tend to take on any issues that either that their administration or their county board determined to be relevant or necessary, but also um, I I think that sometimes it's difficult for CVSOs as we're constantly trying to gauge what the public expectations are in our local communities and determining what those expectations are, what the veterans' needs are, and trying to either take a leadership role in developing something or assisting veterans if there is an existing program with those things, to include nonprofit organizations, local organizations, sometimes even just like volunteers to assist veterans with needs that fall outside the scope of benefits provided by law. So that could include sometimes coordinating coordinating with groups that maybe say plow veterans driveways or cut their grass or help move things from if they're moving to a new place. And so um, I would define a CVSO's role more generally speaking in kind of that within the statute, and a significant part of our time we do spend uh, advocating in the process of accessing federal, state, and local benefits provided by law, and as such as the VA disability compensation, pension, survivor's pension, DIC, et cetera. But we also essentially function as a liaison to the county board, policymakers, and stakeholders on veterans' needs. We function as a liaison to the greater community on veterans' needs, such as today's presentation, giving presentations. And we also work with the veteran community specifically, doing sometimes briefings and participating in other events to educate the veteran community on their benefits in general. And kind of in line with that, a lot of how we do, especially the latter part and working with, and the first part of that, which is assisting veterans in applying for benefits, is we do that in interviews or walk-in meetings with clients, sometimes over the phone or virtual meetings and so forth. That being said, and I'm not here on behalf of our county veteran service officer or Minnesota Association of County Veteran Service Officers, but I have been active in discussing this with them over the last few years. But there's quite a bit of variability from county to county in terms of the degree of services provided, sometimes the scope, of services, but more or less the depth of services provided by each county veteran service officer. I can tell you, say, such as in Stearns County, we don't have, say, a transportation program. And then in other counties, some counties may be more involved in, say, VA healthcare than other counties. So the Veterans Benefits Administration, VA disability compensation, is probably the biggest uh, benefit that we assist with. I estimate somewhere between 50 to 60%, maybe even more, of our time in our county veteran service offices is spent assisting veterans with disability claims. And I would say that kind of includes, there's a number of secondary actions or ancillary benefits tied to disability compensation that I would consider also falling in the realm of compensation. But essentially, what is disability compensation? VA disability compensation is somewhat similar to Social Security disability. It's completely different administrative law governing both of them. So it's not exactly the same thing, but VA disability compensation is essentially uh, disability payments, or initially just getting the VA to recognize that a veteran has a chronic disability that stems from something that happened on active duty, or the condition manifested on active duty, or is related to something that happened, such as an exposure or something of that sort. And then depending on the level of disability, the VA can pay the veteran some compensation as a result. So the idea is that uh, the reason why the VA pays out is you can't, there is no process for workman's compensation, or you can't sue the military for injuries and accidents that happened as a result. So the VA has this disability compensation process to allow uh, service members to be compensated for the loss of earning capacity or the potential earning capacity. And that's how they develop the VA disability compensation payment scale. But there are many different ways that veterans can establish service connection. There are three basic elements to service connection. There must be an in-service injury, there must be a current chronic disability, and there has to be a nexus between those two things. So sometimes it's simple, and sometimes it gets quite difficult or maybe complicated. Not always difficult, but complicated. Um, I guess one thing to keep in mind, similar to Social Security disability, this is an administrative legal process. The veteran has to initiate a claim. There's no time frame for a veteran to initiate a claim. Once a veteran initiates a claim, the VA obtains evidence. They review and weigh that evidence, and then they issue a decision on that claim. So one common question that we get is, how long does it take, for the VA to decide a claim? Occasionally, you'll hear something pop up in the news about how it is taking the VA. The VA is backlogged and it's taking them a long time to issue decisions on claims. Honestly, most of the news stories that I read or hear of are missing a lot of information, and I'm not. The VA certainly screws up plenty of things, but it's not always to the veteran's benefit that a claim is decided quickly. The VA is bound by their regulations in terms of what's necessary, having the evidence necessary to grant a claim. So pushing the VA to issue a decision quickly sometimes really just only expedites the denial on benefits, and typically results in the VA failing to properly develop claims, seeking out evidence, and so forth. Just for your reference, if anyone's interested, roughly the time frame it takes, to do a claim or process an initial compensation or different types of claims, it varies quite a bit depending on the specific circumstances unique to each claim. However, say an initial compensation claim, typically we would expect it to take about 4 to 7 months. A supplemental claim, which is either reopening a claim that was previously denied and is outside of the appeal window, or submitting new evidence in a claim that was recently decided. Typically, we're seeing those take about 2 to 4 months. Now, the VA kind of restructured their process a few years ago for appealing, and what used to be a supplemental claim used to sort of fall under the appeal process and now is not. So appeals to the Board of Veterans Appeals, we're actually seeing those take about a year and a half or more, which is pretty disappointing. The VA pushed out a change, or there was a new law passed called the Appeals Modernization Act back in 2017. And the goal at that time was to reduce the amount of time it took for BVA appeals and to eliminate the backlog. And they had made quite a bit of headway on that over the last year. But shortly after COVID struck, we saw basically those appeal timeframes get pushed back to where they were pre-AMA. So that's been disappointing, but unfortunately not surprising with the VA. A couple other things: when the VA does grant service connection for a claim, a veteran can be rated anywhere between 0% and 100% for their overall rating. The VA rates a veteran in increments of 10%, and pay for disability, at 10% is roughly $144 a month, and 100% rating is for a single veteran is $3,146 a month, just for everyone's reference. The next benefit that I want to talk about is something called VA non-service connected pension, and as well as VA survivors pension. They are both income-based benefits, income and asset-based benefits available to veterans and the surviving spouse of a veteran who served during a wartime period. Veteran had to have at least 90 days of active duty service, with at least one of those days during a wartime period, and had to have an honorable discharge. That service criteria is the first part. The second part is an income asset determination by the VA. The non-service connected pension, the thresholds are pretty low, and the VA does not. It's not like you qualify and then the VA pays you a certain amount. They pay up to something called the maximum allowable pension rate, and there are different pension rates, or MAPRs, based on the amount of, or excuse me, based on the circumstance or the veteran's need, such as whether or not the veteran is generally, well, I'll say the veteran or the claimant, could be a surviving spouse as well. But whether or not they are generally housebound, or if they are in need of aid and attendance or assistance with activities of daily living, any of those things can result in a higher maximum allowable pension rate, and thus a potentially higher monthly payment. So there is I think 2 years ago, the VA implemented a 3-year look back on transfers. And so it is the veteran or the claimant's responsibility to notify the VA if there were transfers. And just to give everyone an example, so basically what the VA does when they're trying to figure out what the veteran is going to be eligible for in terms of their actual payment is they will take a maximum allowable pension rate and they'll subtract their veteran's income for VA purposes from that MAPR, and then they will divide that by 12, and they will get the veteran's monthly payment. So, for example, if the veteran's income for VA purposes was $0 annually, then the veteran, for a single veteran, would be eligible for $1,160 a month. Now, if that veteran income for VA purpose day was $500 a month, then that $1,160 payment would be, they would deduct that $500 from that $1,160 payment. Now, if the veteran goes over that threshold, then they're simply ineligible for pension. They're not eligible. Additionally, if the veteran has a disability compensation rating and they apply for pension, they can't receive both of them. They can receive either or they'll receive whichever is the greater benefit. So the rules for pension are exactly the same for the surviving spouse or for survivor's pension, with an exception that the monthly amounts and or the thresholds are all different. So for a surviving spouse, if the surviving spouse's income for VA purposes is $0, then the monthly payment that they would be eligible for is approximately $778.66. So how does a veteran or a surviving spouse, have an income for VA purposes of $0? Typically, it's when they have their out-of-pocket medical expenses are exceed the amount of income that they have coming in. So the VA allows veterans and surviving spouses to deduct their out-of-pocket medical expenses. That includes, say, any private health insurance monthly premiums. That includes the Medicare Part B premiums. That includes co-pays, prescription co-pays, dental insurance. That includes long-term care insurance, etc. So all of those things can be added up and deducted from the veteran or surviving spouse's income, and in order to determine their income for VA purposes. Okay. The next benefit I want to just kind of point out or discuss a little bit is burial benefits. I would estimate that approximately 10 to 15% of our CVSO workload, at least in our office, is spent working on burial benefits, and typically working with either the surviving spouse or the children of a veteran that passed away. I would categorize burial benefits in there are several different types of benefits. One is a reimbursement of burial expenses. Another is a burial marker or medallion. Another is Bronze Star markers. And though it's not really any of these, we do assist sometimes with the cemeteries and tracking down DD 214s if we don't have it in the county, in order to get the veteran placed in a cemetery, such as the state veteran cemeteries or the federal cemetery in St. Paul. There are 3 different types of burial reimbursement for expenses. In order to receive those, a veteran has to have been service connected or receiving pension, or have passed away under VA care or under contract care. And there are 3 different rates that the VA pays. So for a non-service connected death, the VA will reimburse $300 for reimbursement of burial expenses, and $807 for the cost of the plot if the veteran is placed in a private plot. For a non-service connected death at a VA medical center, the VA will reimburse $807 for the reimbursement of burial expenses, $807 for the plot if there's a private plot, and they will also cover the transportation costs. For a service-connected cause of death, the VA will reimburse $2,000 for the death and burial expenses, and then they can also cover transportation if the veteran passed at the VA. Transportation in general can also be covered if the veteran is buried at one of the national veteran cemeteries. Okay, state benefits. So I don't have this in my slide, but the state of Minnesota the state of Minnesota administers a number of different benefits. The ones that we deal with the most, again, I would estimate probably 10 to 15% of our workload goes into state benefits. But we're looking at the VA or the state of Minnesota SSAP program, or State Soldiers Assistance Program. They have a number of different grants. They have a dental and optical voucher. They have a special needs grant, and they have a HUD-VASH grant, and they have a disaster relief grant. So the dental and optical voucher is an income-based benefit. The dental and optical voucher, I believe the threshold for a single veteran is right around $1,800 a month in income. They have to be below that, and they can't have more than $3,000 in cash assets. However, if they qualify for the dental and optical voucher, they are eligible to get $1,000 in treatment for dental care annually, as well as up to $400 in optical care annually. The VA or the state has a special needs grant. It's a once in a lifetime grant. Some people will say it's a $5,000 grant. It is not. There is no actual threshold or a dollar amount threshold, but basically it's an emergency grant, and the veteran has to have no income, or excuse me, not have the ability to cover the expenses. So for an example is, if the veterans, if a veteran or their family, if their furnace goes out in the middle of winter, and let's say it's going to cost $6,000 to replace the furnace. The veteran, if the veteran only, let's say they only have, let's say $6,000, in the bank account, they could request assistance. The state might approve, say, paying $3,000, for the furnace, and they might say the veteran needs to cover the other $3,000. In other circumstances, they might say, well, it is sort of a subjective process, but if the veteran doesn't use the special needs grant during their lifetime, it is something that the spouse can use after the veteran passes if an emergency need arises. If the veteran has accounts like retirement accounts, stocks, and those sort of assets, the state does require them to withdraw out of those assets first, even if it's at a penalty. These programs were not designed to protect assets, but it is still a great benefit, and we do help quite a few folks, unfortunately, with that. There's something called a HUD-VASH grant, or through the VA. The VA medical centers have something called a HUD-VASH voucher. And it's to assist, it's similar to like a Section 8 voucher through the county, but essentially it's a voucher to cover rent for veterans that are homeless. And the state has a grant. Under the HUD-VASH voucher, it doesn't actually cover the deposit to get the veteran into housing. And so the HUD-VASH grant through the state will actually cover that deposit if they have a HUD-VASH voucher in order to get the veteran off the street and into housing. Additionally, there's a disaster relief grant. We don't see these all the time. In order to qualify for a disaster relief grant, the governor has to issue an emergency declaration for the entire county. And so that doesn't happen very often. However, last year, due to COVID, the governor, under the emergency orders, did make approximately $6 million available for a couple different grants, one of them being a disaster relief grant for COVID-19, which included a $1,000 payment to anyone that basically could show that they were impacted by COVID-19 and were veterans. The state administers a handful of cemeteries. I believe the cemeteries currently in operation are in Duluth, down in Preston, Minnesota, as well as one most folks are probably familiar with in Little Falls. The MDVA, Minnesota Department of Veterans Affairs, also runs a handful of state veterans homes. Currently, those veteran homes are in Fergus Falls, Laverne, Silver Bay, Minneapolis, and Hastings. We don't get a lot of veterans in the St. Cloud and Stearns County area interested in the veterans homes because none of those locations are close to St. Cloud. However, the veterans homes are an excellent resource to veterans, as they're not free. It's not free for veterans to go there. However, it is very reasonable in terms of the cost and significantly cheaper than going private pay. I don't have a lot of interaction with Minneapolis or Hastings, but the veterans and families and the staff that I've talked to from Fergus Falls to Laverne and Silver Bay are I hear all positive things. There are soon to be additional veterans homes added in our built here in Minnesota. We're looking at Montevideo, Preston, and Bemidji. There will be some state veterans homes here in the near future. I believe Montevideo and I think Preston, they broke ground here recently. In addition, so MDVA also has a higher education program. They have regional reps located throughout the state of Minnesota that assist veterans and their dependents in applying for VA or veteran-related education benefits, to include the VA GI Bill benefits. In addition to the federal VA GI Bill, the state of Minnesota also has a state Minnesota GI Bill, and for up to $10,000. So that's for veterans who have used up all of their federal GI Bill benefits, as well as for dependents of veterans that are 100% permanent as a result of a service-connected disability. So, and then on top of that, they also have a one-time $750 grant through their Veteran Education Assistance Program. So, one other one I think that the state does and people don't talk about a lot is their state parks access. So I think we could list it as an ancillary benefit that's dependent upon a VA disability compensation rating. But veterans who are service connected and have a VA ID card that shows service connected, they're eligible to get into any state park and get an annual state park pass for any state park at no cost to them. Okay. Any questions out there? I feel like I'm talking a lot. No one has questions.
We have none in the chat yet. We don't have many in the room, so anyone who has questions, please feel free to speak up. I think we can manage it to do it that way if you'd like.
It's very difficult to offend me, so please interrupt if you have a question. Although that wasn't a challenge to try to offend me. Okay. The VA healthcare system. So St. Cloud, there are two VA medical centers in Minnesota. They're the St. Cloud VA Medical Center and the Minneapolis VA Medical Center. Each of those VA medical centers have a catchment area in a variety of counties that kind of fall under that. That being said, there are other VA medical centers out of the state that do serve counties in Minnesota. So those include Fargo, Sioux Falls, and Tomah, Wisconsin. There are a number of CBOCs or community-based outpatient clinics throughout Minnesota. Those include Montevideo, Alexandria, Brainerd, Shakopee, Ramsey, Fergus Falls, Bemidji, Mankato, Maplewood, and Rochester. CBOCs, typically we see those are more outpatient and primary care services, maybe occasionally some specialty care, but such as mental health, but generally primary care. The St. Cloud VA or the Minneapolis VA is a very large VA and has basically any service that I think you can get at a hospital, to include emergency care. The St. Cloud VA, however, I don't recall if it's a level 2 or a level 3 facility, so they don't have an emergency clinic, but they do provide all other essentially outpatient healthcare needs. So you can see in my slide, I I kind of mentioned a variety of different services available to veterans. Essentially, under a few years ago, uh, some of you may recall there was uh, some bad press. The VA got in trouble for the ghost lists for treatment down in the Phoenix, Arizona VA Medical Center. And as a result of that, we had Congress pass some legislation rather quickly regarding the Veterans Choice Program. Well, that program expired, and they passed something called the Mission Act in response about 2 or 3 years ago. And the Mission Act provides or access to care in the community if the VA is unable to provide that care within a certain amount of time, depending on the type of care. But essentially, why I say that is St. Cloud VA does not provide all services, but if they can't provide the service, they're able to provide it through their community care program by referring the veteran out into the community. It's the same with Minneapolis. Even if Minneapolis can provide the care at Minneapolis, if they can't provide it within the time frame outlined in the Mission Act, then they are required to refer it out. So that being said, veterans that are able to enroll in the VA healthcare system, not everybody meets the criteria. There are, I would say, there's a general rule that everybody talks about and or that most people know of, and it's regarding the means test. So you had to meet the length of service criteria, as outlined in the VA 38 CFR, their Code of Federal Regulations, which is if you served after 1980, you have to have at least 2 years of active duty service. Or for in the case of Guard and Reservists, that you served, if you were called to active duty, that you served that entire time and then issued an honorable discharge. And then there's a handful of special exceptions for enrollment in VA healthcare, to include having a service-connected disability rating, having exposure to tactical herbicides in Vietnam or in other areas of the world recognized as having exposed to herbicides, radiation exposure, environmental exposures in the Gulf War, as well as even if a veteran served in a combat zone, if they're able to get the health care for free at the VA for 5 years following discharge from service. So there's a number of exceptions. There's a lot generally to the benefit of veterans, but not everybody is eligible. So if there are veterans, they don't have a disability rating and they're trying to enroll, but they meet the length of service criteria, but their income is too high for the means test, then they may not be eligible for enrollment. If they get enrolled, they're generally enrolled into something called the general benefits package. And the general benefits package basically allows care for almost everything, with generally the exceptions would be just dental care and long-term care. So veterans, to get dental care, they have to have 100% rating through the VA. And to get long-term care, they must have a disability rating of 70%. Now, the VA can provide long-term care if a veteran has a disability rating of 10%. However, the regulation reads that they may provide it, whereas if they are 70% service connected, they must provide that long-term care. So essentially, due to the high demand for beds, the VA does not provide long-term care for veterans under 70% service connected. So the community living center is generally what we refer to as the which includes the long-term care units at the St. Cloud VA. Every VA medical center has a community living center. Not all of them have long-term care. available. Some of them use it for, say, inpatient locked mental health care and that sort of stuff. But the St. Cloud VA has probably one of the larger long-term care units in the country, and they also have respite care as well as hospice care at the VA available. Um, there are a lot of benefits and assistance available to veterans through the VA healthcare. Um, I'm not going to go through them all right now. It's essentially everything, almost everything you would be able to get outside of the uh, outside in the private sector. The difference would be is that it is a government-run program, and so there are uh, there are there are processes sometimes for getting things, and sometimes it's a little bit there's a little bit of red tape. Um, One thing I will just mention that's on the slide here, it's something called the HISA grant or HISA, depending on who you're talking to. The HISA grant is a home improvement special adaptation grant that's available through the VA prosthetics department, and can be used for veterans to adapt their house to accommodate some type of disability. So that can include, a lot of times, one of the most common that we see is a wheelchair ramp. Veteran needs assistance, or widening doorways, or making some remodeling or modifications to a bathroom so that a veteran can use the toilet without assistance, or get in and out of a bathtub or shower more easily. Okay.
Cory,
Ancillary benefit. Yes, sir.
well, I was going to say, we did get a question in the chat. Would you like to take that one?
Yes, I can't see the chat here.
I think this one came directly to me. It asks, is there anything new on the Camp Lejeune water contamination issue?
There's nothing new in the last 2 years. The last action was the VA did so the last action that I recall is that the VA did create some presumptives related to the Camp Lejeune water exposure. And when I say presumptives, that means that the VA is recognizing certain conditions are presumed to be related to the exposures at Camp Lejeune. So generally, if anybody that served in the military spent 30 days or more cumulatively at Camp Lejeune, I forget the exact dates, but it's from the 1950s into the 1980s. The VA recognizes that there are certain disabilities related to that. And I can Google that here once as I'm looking it up. Separately, the VA has also recognized eligibility for treatment for family members and veterans that served at Camp Lejeune, but they have a separate list of disabilities. So the VA list of presumptive conditions is smaller than the conditions listed for treatment. And so I haven't seen much action on that in the last couple of years. I haven't seen a lot of claims come in for those issues. But for anyone who doesn't know, there was contaminated groundwater for many years at Camp Lejeune. Part of it was related to some commercial chemicals. Well, they said it was related to uh, uh, I'm trying. I think it was. They did some. I'm having a moment here for cleaning clothes. I can't recall. But those. There does that. Hopefully, that answers the question for the person that asked. There isn't anything new other than those things, and those came out 2 years ago, as far as I'm aware.
And there is
Any
another
follow-ups?
question.
Go for it.
I was going to say another question in the chat. Is there a mileage number before you can use local medical?
There is, yes, under the Mission Act. I'll have to double check that too to be sure that I give the proper mileage, but I think it's 40 miles. but it could be, it was either, let me back up. I don't think it's a mileage under the Veterans Choice Act. It was a mileage, and it was as the crow flies. So I think it was approximately 40 miles. And I think now, I think it's not. I think it's 30 minutes. They changed it to a drive time. There's some nuance to that, in that if you elect to do care in the community under the Mission Act, then you might be limited to just the services through that community provider. You can't go back and forth between using the VA medical center and using that community provider. I believe you have to choose one or the other. But there's a drive time for the services that will allow the VA to make a referral to the community as well. So for example, sometimes we'll get the VA trying to send a veteran in Stearns County or down to Minneapolis, and the veteran may, for specialty care, but the veteran is beyond the 60-minute drive time for specialty care, and thus the VA then has to refer it out into the community locally instead of sending the veteran to the Minneapolis VA. Does that answer your question? Or, that could be, because there's kind of two different scenarios. In some cases, the VA can send something out for one specific treatment. So there's a drive time for that, but there's also, if you just generally want to get care in the community for everything through a local provider. I'm not sure which the person was referring to.
That question didn't have anything else in it there. And just to give it, we're about a 5 minute remaining on the presentation.
Okay, sorry.
No problem.
I will just say that there are a lot of ancillary benefits for veterans. There's more. Some of these things I've already mentioned. I'm not going to go through all of these, other than to say some of the more local benefits provided by the state and counties. Some county veteran service offices do offer transportation services. Some of them have a transportation van, but it varies quite a bit. In Stearns County, we do not have a transportation program, but many of the counties around our area do. So I would encourage folks, if you're talking to constituents or community members that are veterans, contact your local VSO to find out if they have a transport program. If they do not, the VA also, under certain circumstances, can provide transportation. And there's also DAV. DAV has a transportation program as well. So there's a variety of options for transportation. And then one thing that I do think may be a little more relevant to everyone here is the state has a disabled veteran property tax exclusion program administered by the counties or the property tax administrator. There are two different exclusions. There's a $150,000 exclusion, and there's a $300,000 exclusion. Veterans eligible for the $150,000 exclusion have to have a disability rating of 70% or up to 100%. And to be eligible for the $300,000 exclusion, veterans have to have a disability. They have to be 100% permanent in total, and that permanency designation must be made by the VA to qualify for that $300,000 exclusion. Surviving spouses of veterans can continue if the veteran died from a service-connected disability and the spouse is awarded DIC. The spouse can get that $300,000 exclusion towards the assessed value of the property. Or if the veteran already had the $300,000 exclusion, that surviving spouse can apply and get that continued on the same property. If just passed, I believe it was last year, they can transfer the surviving spouse can transfer that exclusion one time, but only to a property of equal or lesser value than the property that was previously receiving the exclusion. And then CVSOs also coordinate with a number of local veterans organizations and charities to include, say, like local DAV chapters, Beyond the Yellow Ribbon organizations, in assisting and coordinating sometimes volunteer efforts or some small funds assistance and so forth. With that being said, I am going to not talk about changes and just kind of stop here and say, is there any questions, or are there any questions anyone else has that we haven't covered? Please feel free, if you want, raise your hand or come off mute and just ask.
Say once again, Cory, I just want to thank you for coming and being a part of this tonight for us. So thank you so much.
Thank you, Mr. Wells. I appreciate the invitation. I hope it was of some value to you guys. I do think it's always good to get information out there about CVSOs and what we do. I appreciate it. Thank you.
All right, thank you, Cory, very much for the presentation. It was a wealth of material, and folks, we'll close this one out, and you'll then be redirected back into the general room, and where you can make a selection for the second breakout.